After the patient has had the surgery performed, the patient is given discharge instructions, in which most frequently is ice again, elevating again to decrease the swelling and decrease the inflammatory response. I put patients on postoperative aspirin to help chemically thin out the blood, again to try to decrease the chance of having clots. I can't prevent them from happening, but we try to minimize the risk associated with it. This is most frequently in lower extremity surgeries. There are other medications as far as hip replacements and knee replacements, in which the patient may require injections of an anti-coagulation medication, and that usually lasts for approximately 3 to 4 weeks. On most of the knee arthroscopies, these can be given just as far as the aspirin is concerned to help decrease that chance. I usually see the patient again follow-up somewhere between 7 and 10 days afterward. If there is going to be infectious changes, we usually see that around post-op day number 5 to post-op day number 7. So we like to see the patient around that time frame in order to evaluate the wound and make sure the patient is stable. The patient will follow up, and they may be on crutches or a walker, or they may be using a sling for an upper extremity surgery, and they will be seen, at which time the sutures are usually removed. Again, depending on the location of the surgery and the quality of the actual wound as far as healing. Unfortunately, some patients do have predisposing side effects or predisposing conditions such as diabetes or thyroid that may compromise a wound healing. And unfortunately, in this particular day and age, obesity is a major problem, and that also does affect the wound healing. When the patient's seen in the post-op visit, the patient's usually instructed on pain medication to check their overall status and level of pain. They're giving a description as far as what we saw at surgery, and we discuss what our treatment options are in the ensuing months associated with the post-operative recovery. Frequently, the patient will be placed into a physical therapy program, and referrals are made at that time. The physical therapy program will work with the patient several days a week in order to maximize the range of motion, maximize the functionality, and try to minimize the stiffness, and that's usually associated with scar tissue. I like to see patients at approximately the 3rd or 4th week post-op to check their overall status as far as the range of motion and making sure that the wound is completely healed. If there is any problems prior to that, they are free to contact the office at any time, and we will see them in that particular time frame.